Hi, today I'm going to explain to you what the experts recommend if you think your child has a fever or a high temperature.
About 30% of children's visits to the emergency room or doctor are related to fever. So, what is a fever?
The average body temperature is 98.6 degrees Fahrenheit or 37 degrees Celsius. But normal body temperature can range between 97 and 99 degrees Fahrenheit or between 36.1 and 37.2 Celsius.
A temperature over 99 degrees Fahrenheit or 37.2 degrees Celsius most often means you have a fever caused by an infection or illness. In a way, having a fever or a high temperature is a good thing because the immune system is working hard to fight the cold, flu, or other infection. Symptoms of a fever in a child include loss of appetite, being irritable or fussy, feeling warm or hot, feeling tired, sweating, shivering, or difficulty sleeping. Children who can talk may also complain of body aches, headaches, and feeling hot or cold.
The following thermometer readings generally indicate a fever. Oral temperature of 100 degrees Fahrenheit or higher, or 37.8 degrees Celsius or higher.
Rectal, ear, or forehead temperature of 100.4 degrees Fahrenheit or higher, or 38 degrees Celsius or higher. Armpit temperature of 99 degrees Fahrenheit or higher, or 37.2 degrees Celsius or higher. Treating a fever at home.
The goal of treating a fever is to relieve discomfort and get some rest.
If your child is uncomfortable, irritable, or restless, these home strategies may help. Offer plenty of fluids such as water, diluted fruit juice, ice pops, and Jell-O. Avoid giving sports drinks or oral rehydration drinks like Pedialyte unless the child is vomiting or has diarrhea. Let her get plenty of rest. Dress her in lightweight clothing and cover her with a light blanket to help with chills. Bathe him in lukewarm water. Do not give cold water or ice baths because they can make him shiver and raise his temperature even higher. Avoid using rubbing alcohol since it can cause seizures or even coma. Monitor the fever by taking the temperature every few hours. Pain relievers may also help, but with some precautions. Do not give aspirin to anyone 18 years or younger. Do not give an infant any type of pain reliever until you've contacted a doctor or nurse or your child has been evaluated. Children under 6 months may be given Tylenol or acetaminophen, which is the generic brand of Tylenol. Please follow the directions on the label carefully. Do not give Tylenol to infants under 6 weeks. Children ages 6 months and older may be given Tylenol or ibuprofen. Ibuprofen is the generic brand for Advil or children's Motrin. Do not give ibuprofen to children under 6 months. Again, please follow the directions on the label carefully. What you should do about a fever depends on the age of your child. Call your doctor or nurse if your child is younger than 3 months and the rectal temperature is 100.4 degrees Fahrenheit or higher, or 38 degrees Celsius or higher. Children this age do not have a fully developed immune system, and they are vulnerable to serious infections like pneumonia and bacterial meningitis. Your child is between 3 and 6 months and has a temperature above 101 degrees Fahrenheit or 38.3 degrees Celsius, or has had any fever for more than a day. Your child is between 6 months and 1 year and has a temperature above 103 degrees Fahrenheit or 39.4 degrees Celsius or higher, or has had any fever more than a day. Your child is between 1 and 2 years old and has had a high fever for more than 24 hours.
And finally, you should call the doctor if a child of any age has a temperature of 104 degrees Fahrenheit or 38 degrees Celsius or higher.
When to go to the emergency room. Although you may have done your best to care for your child, sometimes the best thing to do is to take your child to the emergency room. Take a child to the emergency room when any of the following happens. You have some serious concerns. You're unable to contact the child's doctor. Your child is younger than 2 months. You suspect the child is dehydrated.
Your child has a seizure, purple or red rash, difficulty breathing.
Your child has a headache that will not go away, is vomiting, or has other complex medical problems.
Letting your child's fever run its course may be the best way for the body to fight the underlying infection. And remember, the most helpful home remedy of all is lots of TLC, tender, loving care.